Hi, I'm Dr. Rodrigo Villar, a pediatrician and public health doctor on the Tohono Nation Healthcare, and I'm here to talk to you a little bit about the vaccine benefits of COVID-19 vaccine, how we can help end this pandemic.
Hi, Dr. Villar. What are the benefits of a COVID-19 vaccine?
So COVID-19 vaccination can protect you and your loved ones from getting COVID-19. All of the COVID-19 vaccines available in the United States have been shown to work really well to prevent COVID-19. The vaccines are so effective that over 94% of people who got their 2 doses of vaccine did not get COVID-19. And that's even better than most of our routine vaccines that we get. While no vaccine works 100% of the time, the people who got the 2 doses of their COVID-19 vaccine and did get infected had a very mild case, so it really helps to either prevent COVID infection completely or to prevent you from getting a severe case. Getting vaccinated is safe, and it will protect you and the people around you. Getting vaccinated is the best way to be protected from COVID-19 and will help us get back to normal.
How safe is the COVID-19 vaccine?
Great question. Everyone asks, is the vaccine safe? So the COVID-19 vaccines were studied with over 70,000 volunteers and were shown to be safe. Although some people had mild side effects, including headache, soreness, feeling tired, no one in the studies had any serious issues from the vaccine. Some people might have an allergic reaction to the vaccine, so we always have a health provider on site available to help. Doctors will continue to check for any side effects of COVID-19 vaccination. And you can help by downloading the vSafe app on your phone when you get vaccinated. The vSafe will text you and ask how you're doing and see if any issues came up. And that way we can help the CDC and help each other know if there are any other side effects that we need to look for.
What is the difference between natural immunity and immunity from the vaccine?
Although some people who get infected with COVID-19 may develop some natural protection or natural immunity, the protection only lasts a few months. We know that people can get COVID-19 more than once and it can still spread to others. Getting vaccinated for COVID-19 is safe and seems to protect people for a longer time without getting sick and also without spreading the illness to other people. Getting vaccinated is far safer and better than getting infected with COVID-19 and possibly having a severe illness or death. With vaccination, you get protected without getting infected.
How important is the vaccine?
So COVID-19 vaccination will be an important tool to help stop the pandemic and get us back to normal. Wearing masks and keeping distance can help reduce our chances of being exposed to the virus or spreading it to others, but these measures aren't enough to end the pandemic. Vaccines work with your immune system, so you will be ready to fight the virus if you're exposed. Getting rid of the virus will help us end the pandemic. We need all the tools we have to stop the pandemic. The combination of getting vaccinated, wearing a mask, washing your hands, and watching your distance will offer the best protection from COVID-19 and help us get back to normal. Right now, getting vaccinated is the best thing you can do for you and your loved ones.
With limited supplies, who should be vaccinated first?
Good question. Because the supply of COVID-19 vaccine in the United States is expected to be limited at first, the Centers for Disease Control and Prevention has provided recommendations to federal, state, tribal, and local governments about who should be vaccinated first. CDC's recommendations are based on recommendations from the Advisory Committee on Immunizations Practices, which is an independent panel of medical and public health experts. The recommendations were made with these goals in mind. Number one, to decrease the death and serious disease as much as possible. We know that some people are at much higher risk for getting sick or being in the hospital or even dying. Number two, to preserve the functioning of society. We all need to keep our lights on, keep the water running, get food, and really have some semblance of normality. And the third point is to reduce the extra burden of COVID-19 that is having on people already facing disparities. We know that some groups, including Native Americans and Alaska Natives, have higher rates of hospitalization and death with COVID-19, so we need to get vaccine out to these populations.